Um, okay, thank you. So now these are the components of antenatal care. Now, the component includes when they come, that is the initial visit. We call it booking visit as well. That is the first time we are seeing them. That is the interactive stage. We are getting to know them. So this involve taking their bio data. We ask for their age. Why? Why do we ask for their age? We know people at the extreme of reproductive ladder are prone to complications like preeclampsia, like labor obstruction, due to inadequate pelvis, especially for those one in the teenagers, anemia in pregnancy. So there are a lot of conditions that will, complicate such pregnancies. And people at the upper end of the reproductive ladder are prone to have complications like preeclampsia, eclampsia, gestational diabetes, and other medical conditions in pregnancy. So that is the reason for the age. Then the number of pregnancies they have had. This will allow us to determine to assess the risk they might be going through, because some of them that have so many children in the past are prone to uterine atony, uterine rupture based on the history of the previous pregnancies. So then also we ask for if they have any underlying medical condition that they are aware of before they presented for the booking. This will help us anticipate, investigate, and manage them appropriately. So these are some of the. Then we ask for their blood group. We know if, especially for the babies, the patient with rhesus isomerization, that is rhesus negative people, we ask for their, because of this, we need to know if there is incompatibility between the couple, and so that to anticipate hemolytic disease of the newborn, and to preempt and put every strategy in place to ensure that the pregnancy outcome is good. Then some of we discuss we ask them, we try to investigate them. Sorry, I we try to do a medical examination on them from head to toe. We check for if there is presence of anemia, if there is presence of jaundice, if there is a pre-existing condition. Then if they have done previous operation in the past, this can be obvious from the abdominal examination, because we're going to detect the previous scar. We can as well ask about the number of surgeries that they have done in the past. This will also impact, it can put them at risk while trying to deliver them, because people that have had multiple surgery in the past, we know if they come in, to book, we need to talk about the mode of delivery in terms of the another repeat cesarean section. So then we investigate them. What are the investigation that we do? We do urine test, we do blood test. Urine test, if in the case of urine test, if there is a glucose, we know it could be suggestive of gestational diabetes or pre-pregnancy. The type two diabetic mellitus in pregnancy. So this might allow us to we make the diagnosis and prefer uh, necessary care to this group of patients. If there is a protein in the urine, and especially in the presence of elevated blood pressure, so might be suggestive of preeclampsia. So we want to also treat them accordingly to prevent the complication that will arise from such. If there is presence of leukocytes, it could be urinary tract infection. Urinary tract infection is one of the things that could predispose pregnant women to preterm labor. So we assess them further and we give them the appropriate treatment to prevent complications. So then we counsel them on diet, like I mentioned earlier, diet like protein, fruits, vegetable. This will go a long way to help them in the course of the pregnancy. Okay. Then exercise, moderate exercise. I think many people try to ask this question about exercise. That what is it? Can I be doing exercise? but it's not a stressful or too strenuous exercise, because too strenuous exercise could provoke, a preterm contraction or preterm labor. So it is a moderate exercise like aerobics, taking a walk, and doing all this, living a normal day to day, doing normal day to day activities. This will help a lot in the course of the pregnancy and prepare them for delivery ahead. Then prenatal vitamins. This is essential because there's most at times our pregnant women, any pregnant woman is prone to have what we call dilutional anemia, pre-existing anemia or dilutional anemia. Dilutional anemia just means that because that woman is retaining water in her body system. So even if that woman is have a normal blood level, normal red blood cell level, because of the retention, water retention, it makes it go down, and this could impact negatively on the baby because there is need for in transportation of oxygen and nutrient to the baby, which is the function of red blood cells. If this red blood cells is deficient, it could cause a adverse effect on the baby. So there's needs to supplement this. I'm going to talk more on this as we go. So routine checkups. Routine regular checkup, when they come, we check their weight, we check their blood pressure, the pulse, and we try to see. Concerning the blood pressure, we should not be more than, should not be in the hypertensive range. So if we discover any elevated blood pressure, then we try to find out what the cause is and treat appropriately. The weight gain, it is normal for a woman to gain weight during the course of pregnancy. However, for a healthy weight before pregnancy, it is expected that 10 to 12.5 kg is fine during the course of pregnancy. However, some women will say, doctor, I'm overweight, I'm obese. I want to lose weight while I'm pregnant. No, it is not advisable. Fine, you can. The weight gain for people that are on the big side is not the same for the people that have a normal body mass index. So we advise that they should their own weight gain should be in moderation. So such that they should do based on the diet. We counsel them on diet so that they will not get weight excessively, and we encourage them to engage in moderate exercise. This is also important. Then we screen the along with diagnostics tool like ultrasound scan. This allows us to monitor the growth of the baby and to detect if there is we're suspecting gestational growth restriction. When there is a fetal growth restriction, it allows us to detect this on time. Then for the blood screening, we have the various blood screening that can be done. Then to which we allow, like for instance, in the case of gestational diabetes mellitus, we can screen for this. There's something called oral glucose tolerance test, which will allow us to detect this and other infections, which I'm going to talk about in the next slide. Then vaccination, like tetanus immunization, is also important because we are in a endemic area. We cannot uh, be too sure of sterility of the environment. This will prevent neonatal tetanus, and also there is a we give a prophylaxis for malaria. That is intermittent preventive therapy for malaria. We give 2 doses. Now the WHO have approved that it could be given even up to delivery, which we have been doing. Then we try to educate them wisely concerning the childbirth, what to expect, and the hygiene during the pregnancy, then the breastfeeding and how to manage breastfeeding, the positioning of breastfeeding their children, how regularly they should breastfeed, practicing exclusive breastfeeding. This is